Hey everybody, it is March 12th, so I am nine and a half weeks post-top surgery. It's about a little over 2 months. Let me show you. I just took off my tape. So, yeah, my scars have reddened a little bit. I'm not, they're not, you can kind of tell, they're not super straight, but they are a lot smoother, like they're a lot flatter. They're still a little bit hard. I really need to be massaging the scar tissue more. I know that I should, but it grosses me out and it makes me want to throw up. So, this side's a lot redder. It's my right arm, I assume, because I just use it more. I just poked it and there's scar tissue and it just popped. So I'm gonna see, this is okay. So I'm gonna go take a shower and do that and try not to pass out. Nipples, you can kind of tell. Yeah, pretty much every day it looks a little bit different. I'll be like, oh, that doesn't look good, and then it'll go away. I'll be like, oh, okay, it's fine, but oh, that doesn't look good. So yeah, these are just healing up. Can't feel them. They're not popping out yet. I couldn't even find it. Yeah, they're not popping out yet or anything, but it's fine. Any swelling I had has pretty much gone down. Yeah, he left me with, I like the definition that he's kind of given me. I find myself kind of just, walking around and being do-do-do-do-do. Because, yeah, it's a little bit, it's kind of hard to tell straight on in the camera, but I like it. And, yeah, here, too. There was some lipo here. That's where my lipo incision is. It's not gone away, which is, a little bit weird. Because I don't know, I guess because it's, an incision and not just a cut, but it's still there. So that's weird. Let's see, I have a follow-up at the doctor's office in about a month, and I'm anxious to see what they think I'm doing well or not doing well enough, or how it should look or shouldn't look, but I feel like it's basically on par with everything that I've seen on YouTube and stuff, and nothing really hurts very much. There's a little bit of tightness when I reach straight up. I'll feel it right in here. This, by the way, is still quite numb, and here this is numb, and yeah, a little bit of tightness. This is less numb. The actual incision line is mostly numb, except for all of it's numb, and then here, but it doesn't. Yeah, nothing really hurts. I'm officially definitely cleared for most forms of workouts. I don't know about lifting super heavy stuff. I think they want me to wait closer to 10 weeks. So later this week. Yeah, they want me to wait closer to 10 weeks for that kind of stuff. Basically at my 6 week, I don't know, basically I've had a cold, what feels like, from pre-op all the way till now. I've just had a cold, it went away, and then it came back, then it went away. So I haven't really felt like working out. Yesterday was Purim, so we danced a lot. So that was a workout. But yeah, mostly I've just been not feeling well, snot-related things, so I haven't really been working out or anything, but I'm hoping to do that. Swimming, they said I can start swimming also closer to 10 weeks. I might call, actually I think I emailed them about that. I think they're gonna tell me in the email. But yeah, I think closer to 10 or 12 weeks is what they said for swimming, which was my main form of exercise for a while. I got a swimsuit. Where is it? Oh. Here it is. I got a new swimsuit. So I used to wear, basically, I used to wear swimsuits like these. They're like, whatever, Speedo, like racing type. Well, we wore them, I was on the swim team in college, basically, the women's swim team. So I wore like regular suit with, no legs. And then when I would swim at the Y, I would wear that, and I would wear shorts. For modesty purposes, like it's an old swimsuit, it's all stretched out, Anyway, so I bought these, the same brand, but they're, the men's, they're called Jammers, and they're just like shorts. So they go down to kind of like almost to your knee, not quite, like above, they're definitely above your knee. Yeah, so I'm very excited to just wear these, but I'm also a little bit nervous. As far as swimming goes, I belong to the Y, which is like a Christian family-oriented organization. I live in Texas, and I live in Austin, but I still live in Texas, and even if I didn't live in Texas, like, I still live in the world, so, I'm not really, like, I never feel like I'm guaranteed safety anywhere, but, yeah, I'm just, like, imagining, like, oh, look at me, so, I'm looking forward to it, but I also haven't really worked up the courage to do it yet. So if anybody has any words of wisdom for swimming in public, post-op, no testosterone, let me know. I'll probably try it out at like in Austin we have this like public pool, but not like it's like a springs. It's called Barton Springs. But basically like a public pool outside. So maybe I'll try that first. But I'm looking forward to it. I've never felt water. You know what I mean? But so I'm looking forward to that. What else can I tell you? I just read a book that some of y'all might enjoy. It's called Gender Failure. It's like a series of short stories by these two, one's Canadian, no, they're both Canadian, both AFAB, white, trans masculine center, non-binary-esque individuals. It's fluid. I don't want to pin them to anything in particular, but anyway, you've probably heard of Ivan Coyote, and then Ray Spoon is the other one. They're also a musician. They do shows and stuff. It was an okay book. It wasn't a great book, but it was an okay book. Some of y'all might appreciate it. Yeah. So it's called Gender Failure. Check your local bookstore or the internet. I don't think I have anything else to update. I've been thinking a lot about testosterone. I'm moving to New York in a couple of months with my partner. Back to New York, as some of y'all might remember, I lived in New York. I'm from New York forever. So I've done 3 years here in Texas, and I'm over it. But Planned Parenthood New York City just started doing hormone therapy, providing hormones and stuff. But it was never really oh, I don't have access to it. I just never really seriously sought it out. And it's still something I'm on the fence about. Because there's some things I do want, like voice, face to change kind of stuff, broadness, just overall body shape changingness, and voice, I said that. And I'd probably be okay with facial hair, I assume, but actually, you know what, no. I don't think so. I don't think I want, I'm not necessarily seeking out, body hair. Excuse me. Bottom growth is not interesting to me. Acne, I've never had, so it's not interesting to me either. The main thing is, my mom would not be enthusiastic about it. And then it's not, I don't want to say she wouldn't be supportive of it. She wouldn't, stop speaking to me or anything, but it would make her truly uncomfortable. It should make me truly uncomfortable. I have a 93-year-old grandma that I love very much that I don't want to have this conversation with. So I'll probably continue to put it on the back burner, especially since I'm not interested in bottom growth, and I know that facial hair and bottom growth and acne and all those things are like part of the package. You just kind of have to deal with them. And facial hair would be one of those like very visible things. And acne. Oh. But yeah. So it can go on the back burner, or I can just continue to have a cold forever because that's doing great stuff for my voice. So yay. But yeah. So, it's just something I'm thinking about. And have always been thinking about, basically. Just wanted to give you all an update about that. I've also been having, lots of, I don't fit in with anyone feelings, which is partly due to gender, partly due to mental health, partly due to just being a 25-year-old person. So, just letting you know where I'm at. And it's not fit in what crowd do I belong to, but it's more like every single person I talk to, I feel like I'm an alien impersonating a human, and I have a zipper, and I just put on my human face and talk to them, and but I still feel this doesn't feel right. Oh well, life goes on, I guess. Alright. Okay, well, one last look, I guess, because I've been showing everybody. I've gotten so much more vain, every single night, I'll be at my girlfriend's house, and she'll be, in bed, ready to go to bed, and I'll be okay, one second, let me just, go brush my teeth, and I'll, take off my shirt, and I'll just be ooh, who's that? And just start dancing. She's just can we please go to sleep? And I'm yeah, hold on, I'm busy. Hello. Yeah, so that's a thing. And then anytime anybody is oh yeah, how are you feeling? How's the healing going? And I'll start talking about it, and I'll be I'll be do you wanna see? So I don't care. It costs a lot of money. Of course I'm going to show it off. Shit. But yeah, generally I feel great. Oh, that's the other thing. I should be compressing. Today and yesterday I didn't use any compression. I technically only have until the end of the month where the doctor wants me to keep doing that. And I do. I'll do it at work. And I'll do it for the most of the day and most evening, most night times. It's just so uncomfortable. And like I said, I am still using an ACE bandage. I tried a sports bra for a day or two, because at first I was oh, this is compression, but it's really just compression in the band, but it's not compression here. So I was yeah, this is a lie that I'm telling myself so I can stop wearing a ACE bandage. Oh well. Okay, now I'll let you go. Thanks for watching. Bye.